Hi, everybody. It's Kevin and Thea from RPH Ally. Super excited to have you guys here with us. It seems like the world of pharmacy and medicine is always changing, Thea, and an interesting time that things do change rather rapidly is end of year January. Month of January is like now we got to readjust all the insurance plans, all the changes in payment models, et cetera, bring all of our numbers together that look at how successful or not successful we were the previous year. And that's the exact same thing with our team at RPH Ally. We've had meetings talking about, how things went. We were really in an interesting infancy stage of restarting RPH Ally, and having folks like Thea on is just so humbling, for both Sean and I know adding folks like this to the team and getting it ramped up was really exciting. But 2023 is a whole different ball game. We're really just kind of lighting our hair on fire and saying, here's where the whole pharmacy profession needs a reset button hit and needs to be kind of accelerated into what we're going to be moving forward. And I think Thea is one of my absolute favorites when it comes to letting us know what's coming around the bend and then helping us be successful with it. So Thea, I'm going to pass it over to you. I would really love to hear like what's been going on in the world of Thea outside of, slapping a hockey stick around and knocking people against boards.
Right? Seriously, my son plays hockey. For those that don't know, he thinks he's going to be the next NHL All-Star, so he's shooting for the gold at 10. But no, yes, we live a busy lifestyle here. But pairing up with RPH Ally for the remote clinical services channel is a big opportunity for a lot of folks. And as we look to the future of pharmacy, especially around retail sectors, whether you're in retail and looking for, a change because the box store isn't where you want to be anymore. And you're just that burnout stage and need something different, to those independent pharmacy owners who really are looking for other opportunities other than dispensing. These programs of remote clinical services really offer those folks a really good look at what they can utilize in their schooling and clinical minds instead of dispensing. So it's a great opportunity to start looking for these types of programs throughout all RPH Allies channels. There's some amazing channels in there. What, 20 plus channels now? So I mean, it is just an amazing on fire environment for the future of pharmacy, and that's so humbling to be part of as well. And when I look at what the future of pharmacy really looks like, it is going to be the clinical skills are going to keep moving forward. And what that can be is, taking your MedSync programs to the next level, and getting paid for your time that you're spending on those through clinical services. Or if you want to become a consultant and just pair up with doctors and do this remotely for a lifestyle of balance and work. That's why I got started, was because I wanted the balance. To be able to be location independent with my family was important to me. And so that's why I started this 3.5 years ago. And I think it is something that is very, very a great way to really utilize your non-dispensing skills that we were all taught. And I'm excited to be dropping my channel, the content on my channel. And Kevin will kind of talk a little bit more about that, but it's coming out. The syllabus will be out as I review to the year end of 2022. I've had some big projects going on, and I'll be sharing those in the future here too, as the programs throughout my life, whether it's through my business or through my full-time engagement, will be coming out. And it is exciting to share because I get to do this full-time in my business and for someone else. And the results are really amazing. These clinical services can take your small investment through the RPH channel and really 10x your investment. So I'll let Kevin talk more about the channel though.
Yeah, I mean, I think the one thing, Thea, that you and I have talked about several times is just this, like, getting started with stuff can be scary. Like, we just don't know where to go. We don't know where to turn. We don't know what to do first. And we can get led down lots of paths that can be expensive, unsuccessful, and potentially damaging to our overall reputation and the way we deal with those clinics in our areas and other folks. So you're talking about 3.5 years of experience of living this life, right? From what I like to say, the front end and the back end of it, of really seeing like, here are the metrics that are driving decision makers to actually partner with you in the first place. It's not always about just the sheer revenue being generated. It is potentially for us as consultant pharmacists, but for the bodies that actually have to move the needle for you to participate, you've got to have these metrics dialed in and know how you're impacting the way that they're delivering care and the way that they're receiving reimbursement. But I was really wondering, Thea, like from your perspective, like what were some of the speed bumps? Like what were some of the oops along the way? Like what were some of the lessons learned and the hard lessons learned that you're thankful that you've got kind of now under your belt and you're able to kind of share those with pharmacists that are looking to take this on?
Yeah, I think learning how to talk the talk was the hardest part for me. We can go out and find all kinds of information on clinical services through CMS and through chronic care management, remote patient monitoring, all of the buzzwords right now in telehealth. But to be able to speak them to someone and get a response from an office manager, from a physician, even if I've known these people, like small town America, I've known these people my entire life, and still being able to make the conversation move forward and show up in a valuable way. I think there's a lot of opportunity and a lot of tech companies out there right now scrambling to the surface of getting involved with these programs. And I say use caution, because some of them are not going to have your best interest at heart when you're looking at a pharmacist who's never done this before, or offer a service from a pharmacy that you've never experienced, and how to integrate that into a workflow that works well for you. And that's really talking the talk and walking the walk for 3 years across a few different platforms, like whether I'm in the hospital or whether I'm in the consultant office as a clinic or whether it's the retail pharmacy. I know these lands and how to navigate getting into the right people's hands, and also getting into the right workflow so that you're not adding more trouble, because I didn't have anybody to tell me navigate this world of, other than blood, sweat, and tears and a lot of grit, have got me to this 3.5 years later. And, I just think that when you're looking at different things, platforms make it sound easy. Tech companies are going to say what they need to say to get you to say yes. But then are they going to be there to support you? Are they going to be there to be able to walk you through that conversation that you just had that you felt like you blew up, but actually you planted a lot of great seeds? Are they going to be able to coach you and mentor you through that? And I feel like the information is out there. You can go get it. But what you will lack is the opportunity to talk the talk and walk the walk with someone who's done it. And there's not many pharmacists that I know of that are actually doing this as a consultant level, or, even being willing enough to share what they know. I think it's important that, from my perspective, I've always said that from the beginning of starting this consulting company was, I want to leave a legacy bigger than myself in pharmacy. And that's why I give back to the college. That's why I show up at this state association. And that's why I'm showing up here. It's not because I'm going to get rich on a program from this. It really is to share the knowledge, because our pharmacy profession needs us to show up right now and make a change into value, not dispensing. We need to offer value to these patients who are not being cared for otherwise. 9 out of 10 people across America do not understand where their healthcare is today. It's went up. It was 11%. Today it's 12%. I just looked it up. 12% of health literacy across the country. So 9 out of 10 people don't understand what's going on with their health. That's scary. And we have access to the majority of those people as pharmacists in our communities.
And having that access, the thing that is so interesting is it seems like there's a wall that ends up happening. It's either a mental wall or a physical wall that happens between what pharmacy can deliver and the ability to actually deliver it and get it to patients. The things that I hear all the time, Thea, with folks that are looking to jump in these kind of programs are, Kevin, I don't know how to talk to a provider's office, or I don't know how to do the contracting, or the first thing out of their mouths are, we're too busy doing our other billing to add your billing on top of this, or the engagement is too poor. Like we've seen technologies come and go, and the patients just don't care enough to be able to move kind of the stick forward, or all the calls are going to come back to our office anyway. You're not going to be the one handling them. Our nursing team, my providers, are going to have to handle it and not you. And so it ends up just being, more burden for me to take on as an office manager or a clinic manager or whatever the case may be in that status. And the other one that I think is really interesting is that the patient buy-in, in general, like you just see so many companies spurring up, Thea, which, I have, a burr under my saddle with some of these ideas, that they don't want to use pharmacists. They
Mhm.
don't want to use pharmacists because we are more expensive. And they'll use an MA, they'll use people overseas, they'll use lots of other potentially problematic issues, that would come up with these things just to be able to get the service in place and make money off of it. So some of those, Thea, like I know you've run across all of them because you and I have talked about it, but any of those that you wanted to kind of address, like to the group on, what you've seen over this last year, some of the ways you've gotten past these things, and then some of the data, that now is in front of you to showcase like why pharmacy is a perfect fit?
Yeah, I think pharmacists in general are a perfect fit because we don't know what's coming in the door to prepare ourselves for that next conversation. And I think even our pharmacy technicians are well advanced past what an MA can do with regards to patient engagement. Our engagement in the pharmacy world is completely different than anywhere else in healthcare. Well, maybe physical therapy might have a close second there, but when you look at the rest of healthcare, no one has the engagement that we have with the patients as they do coming into the pharmacy. And I think that is kind of this will be a win for us because we know how to have the conversations and we're already having them. It's now let's show up and figure out how to get paid for what we're doing,
Right.
without it being a dispensing of a product. And these programs really allow for that to happen. When you look at call centers that are doing clinical services, they have scripts. And for how long is a patient going to go and buy into someone who has a script? It ain't going to be long. They're going to figure it out. I've had
Mhm.
patients in one program for over 3 years. Same patients, 3 years. They're engaged. They're calling me month after month. Actually, I don't even call them anymore. They're calling me. And I'm like, this is exciting for me to have that close of engagement to these patients. And, pharmacists build rapport within a few seconds of seeing someone, that random customer that comes up to the counter that you have never seen before because you work in you're floating, we'll call it, and you
Right.
walk in and they walk in and you have to immediately build rapport with them. And that's a skill that we have that people overlook. And these programs really allow for us to be able to utilize those skills and get paid for it. With regards to keeping the patient engaged and keeping them going and the adherence to the programs and that kind of stuff. I find that, people say some manufacturers and platforms will be like, oh, just add another device, you'll be fine. And, those 80-year-olds will be fine with a hub and a Wi-Fi. And I'm in rural America and that doesn't fly here. I'm just saying, I cannot add a hub to a patient's home where they can barely use a telephone. And I don't mean that in a disrespectful way at all. That is who you have to deal with in some locations. And so from an adherence standpoint, I've not had any trouble with adherence rates above 80% across all boards. Every month, month over month, patient over patient, 80% adherence, 90% adherence, even sometimes some months we're 100% adherence to being able to make sure that the patient is showing up because they feel like, oh, you're showing up for me, I can show up for you. And it's amazing. And so when you're looking for companies to do the work, or you're looking for a platform company or a device company, scout around a little bit. There are some out there that are going to show you the numbers that you want to see. And I feel like if you're not informed, you're not going to know. And, if you haven't done the homework, and, where I stand out from that, I don't have a platform behind me. I just have used platforms, right? And
Yep.
I understand the knowledge and mindset that you need to come after what it is that's going to move the needle and be of a quality that a pharmacist can stand behind, because we have the opportunity to stand up here. And I hope I can get folks to come along with me and understand the program and be able to do it in their locations too. America at 11 and 12% literacy need us to stand up now.
I remember when you and I are first talking, Thea, and we were really going over different platforms, what they had to offer, and then really distilling it down to like, what do they really need to push out? Like, what are the end data endpoints that are necessary to comply with CMS and billing requirements that now can be taken by a billing team and submitted successfully, right? I mean, getting all those things in line. On top of that, what are the clinical necessities for you to truly make this successful for the patients so they care, the provider's office cares, and you're actually moving the needle when it comes to their overall kind of care? And you brought me folks that did very, very little in terms of like overall like integrations. Like they were just a very simple platform, and this is kind of what they did. You showed me things that were AI based, like there was questioning and answering based on some algorithmic components that can get you information more quickly, so you can dedicate that limited period of time you have to interact with the patients to things that really matter. So what are some of the things, Thea, that someone joins your channel and they're looking for, there's lots of things they want to understand, the basics they want to understand, build them up to foundations, make them experts so they can truly own the space. But also they're going to look for, because they're not going to be writing their own, technologies. The PMS systems don't have them already. The pharmacy management systems don't have them integrated already. So when you're kind of walking them through like vendor selection, let's say, what are some of the keys in your mind? Like when you've chosen vendors over the years or you've utilized them, what are some of the things that in your program you're going to help people walk through when it comes to choosing the right vendor for them?
Yeah, I think, when I started, I wanted a company that would help me, stand up and dot my I's and cross my T's. And that's really what you need to look for. Remember, you're dealing with Medicare or other like insurances. And so to be able to stand up and dot your I's and cross your T's, you want to have experts in the field with you. And I'm not sure that all of these tech companies that are getting involved have experts in their fields. And that's scary to me. I would say that from a quality standpoint, you're really doing the next level MTM with chronic care management. We'll use that as an example. You're doing a next level MTM, and you need to track your time. Does your platform track the time for you? Can you do that yourself? Sure, you can, but it sure makes it easier when the platform does it and then says, oh yeah, look at this. You spent 23 minutes and 13 seconds on this patient this month. And yeah, you have enough time to go ahead and bill for that code, plus the note that you're going to send off. And they help, pull in the clinical data. I would look for a company that, uses the most up-to-date guidelines across all platforms on what your barriers are for these patients and what their goals are. We get updates in January every year of, we'll use American Diabetes Association just came out, right? Like, so that, making sure that they're using the most up-to-date guideline informations to set those goals and help you set those goals. Like there are some companies that don't set goals and you're setting them all. And then there's other companies that don't use up-to-date standards. And so I would say use caution when you're looking for these different platforms. For chronic care management, much like MTMs, you could do it on a Word document if you wanted to, but it's 12 spots. You mark the boxes, check the boxes of 12 things, and you're on your way. But I'm telling you, I don't ever want to have to stand up to a Medicare audit. I've seen some audits come through the health system that I'm like, I don't ever want that scrutiny. And that's really why I moved forward with the platform.
Well, and you've told me too, Thea, that I think this is one thing that you hammer home really well for folks to be able to understand is the Medicare audits matter, but you're not billing them. Like you as a pharmacist are not billing Medicare. So it goes on the shoulders of the clinic team to be able to push this forward and to keep you around in general, right? And so the metrics that can be pulled from this that matter in HEDIS measures or stars scores or whatever the case is, like finding a vendor that gives you some insights on the way that you're impacting some of these things, massive. Like you want to have stickiness. And I think that's one thing that we forget is we just think all you have to do is just keep churning the machine and that's going to make you stick. It's not. Like you have to have the ability to show them more and prove it out. And it's so funny, like our backgrounds in kind of the hospital world, that is something that the executive team and all of the money fiduciary individuals care about the most is we think that we're generating lots of revenue, but oftentimes we have to show the multipliers of revenue that we're creating. And you can't do that without those metrics being in play. So I just love that you focus on that and you educate people on how much those matter, which ones matter, how you track them. Because that's what really moves the needle, not only on the sales cycle of things, but also to justify that program staying in place and being able to pay for somebody like a pharmacist to do it the right way.
Yeah. And I think, when you look at those metrics, it's going to affect any clinic, whether across the board, whatever kind of physician you have in front of you, whether it's a specialist or, private family practice in a small community, they're all going to they're all going to know the talk around quality metrics and what a pharmacist can do. And for those that don't know what the quality metrics are, just for a quick overview here, there's really three that we have are in our wheelhouse, and they're the same ones the pharmacy gets, hit with too, around medication adherence, around diabetic medications, hypertensive medications, and cholesterol medications. And those three measures in the physician world are triple weighted. And so, do you think an MA can move the needle? Do you think a pharmacist can move the needle? We know what to say to get our patients engaging. We know what to say to offer value and understanding for them to get where we're coming from and why we are pushing this so hard on them as the patients, to get them to take their medications. And so the conversation changes when you start looking at those quality metrics. And your revenue is going to go up if they start, independent pharmacy owner gets 12 refills instead of 9 refills out of this patient because they're taking all 3 of their medications, and now we're up to 3 more extra months of revenue. And that quality metric is one that will set the stars for the pharmacy, but it also is the same metric for the hospital and the physicians. And so why is pharmacy left out in their silo again? Because we're all doing the same work. We all want the end goal. And so, I guess where I excel is because I've worked in all 3 areas of, institutionalized hospital stuff. I've got clinic stuff behind me and retail pharmacy behind me. And, I pull it back to, can I make a comparison that a pharmacist will understand? And that's what I do really well, because I've walked the walk on all 3 levels to be able to really bring it home to having those folks that are going out and seeking these collaborations and service agreements for, I'm going to give them the opportunity to speak on a level that they get. They get it and they can speak it and they'll understand and move forward. And I just don't think if you went with the plain tech company to set up your program for you, that you're going to get that kind of help, right?
No, never. And I think that if you want that kind of help, anybody listening, or listening to this recording and being able to see, like, how do I get intimate with everything in the care management, remote care services world and really be successful for myself, my facility, my patients, she's right here. Right. And so the only way that you get over to Thea and get to utilize her services at a deeply discounted rate that she already said will be 10x for you in the first 6 months, that she's proved out her own data and showing that in her own patients, head over to RPH Ally, bring your registration information to show you're a pharmacist, jump on board. Her channel, totally free to join, just to be able to check out the stuff that she's talking about, some of the insights in the industry that she's offering. She's doing lives and recordings to be able to show you guys, stuff to be able to help you get started and think about. And then when you're ready, be able to purchase, her package to have an entire year with an expert that can guide you along the way, help you through all the speed bumps, and just one of my really good and close friends. So I look forward to you guys joining and taking full advantage of all the cool stuff that Thea has going. Any parting words for us, Thea, before we sign off?
No, well, I'll say 2023 is going to be the year of growth, and it's going to be to get personal. And I think that if you want the personalized touch to help implement and get a program going because you need it, because you want to make the change or you need that revenue stream, I'm here. And that's my whole approach. It's not a random set it and forget it course. It's me being in their personal mentorship, coming along with you, because that's how you win the race. So I'd love to win the race with them.
That's fantastic. Well, perfect. You guys have a wonderful rest of the day. If you have any other questions, you know where to find Thea and I. We'll see you at RPH Ally. Bye.